I always disclose when I'm recommending an eye cream that this is not going to be a magic eraser for your under eyes. I think there's only so much that an eye cream can do. And if you're looking for some mild to maybe moderate improvement, you'll get there, but it's not going to be your fix all.
Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skin Side
Out.
Welcome to Skin Side Out, where science meets beauty. I'm your host, Dr. Zain, with Courtney and Heather. So have you ever had anyone who told you that you look really tired or hollow, you kind of look sunken in? So the under eye area is a very cosmetically sensitive area, and a lot of people have concerns. It's probably one of the earliest places we see signs of aging. So let's dive into the under eye area, what type of anatomy that we're dealing with, what type of issues that we're seeing cosmetically, and how we can fix them. Why is the under eye area so challenging to treat?
I think there are a couple things. Number one, it's one of the thinnest areas on our body. It's very low in oil glands. We're constantly tugging at that area. Now, you may think, okay, probably the most common way I tug at my face is like washing my face. But actually, as we move our eyes throughout the day, blinking, that can subtly move the under eye tissue and skin and kind of advance aging a little bit quicker.
It's funny, I just think about a few years ago before I got glasses for not being able to see far away. My mom would yell at me when I was watching TV to put on my glasses because I was going to squint and I was going to cause wrinkles. And I said, oh, it's a good thing I work where I work and I can just get Botox. Easy solution. But I did get my glasses finally.
I think it's one of the first places that people notice, like, if you look tired, or it's an easy place to lose volume as we get older as well.
Absolutely. And since the skin is so thin and sensitive and delicate, it is very prone to getting irritated. So allergens, either in the environment or in products that you're using on a daily basis, that can lead to irritation. Also, since it's so thin, we see the effects of fluid in that area. So if you suffer from seasonal allergies, for instance, you can see that edema or swelling, and that can make you look puffy or, just not well. It just looks more like sunken in and dark. In addition, you can see congestion of the veins and around that area. So, allergies can play a role. Also with your diet, eating more salt, you can look a little more puffier. So you can see a lot of different changes because the skin is just so delicate and thin there.
Speaking of the skin, do you want to kind of go into the different layers of the under eye? So, of course, the skin is on top. We already mentioned how delicate it is, but next we have a couple different layers.
Absolutely. So eyelid anatomy is complex. There are actually a ton of different structures within a very small amount of tissue. So you're looking at the skin, obviously, as the outer surface. Then you're moving on to subcutaneous fat. And this area has very little subcutaneous fat, like we see in other parts of the body. However, we have a muscle right below that, the orbicularis oculi muscle. This is the muscle that's responsible for a lot of the movements around the eyes, for like blinking and closing your eyes. And beneath that is another layer of fat. So that's the orbicularis oculi fat. Also, sometimes we refer this to the suborbicularis oculi fat, also known as SOOF. So that's a cute little acronym for that anatomy, which we'll get into a little bit later. And then lastly, below that fat, we have the orbital bone. So a lot of anatomy going on in a very small area.
Yeah, and as we know, as we age, we start depleting in, our collagen, our elastin production. You'll notice the skin thinning. So especially when the skin is already so thin, it's going to continue to look more hollow and more sunken in. Our fat pads, they can either shrink or even sometimes shift. So sometimes you'll notice, as you get older, almost like those, it looks puffy, but it's not actual edema. It's those fat pads. And then even sometimes the bone itself can resorb. So I think there's a lot of different things that happen as we age that contribute to that sunken in kind of appearance.
Yeah. And then I just kind of want to differentiate that sunken in appearance versus the protuberant like fat pads. So they're totally different problems. You can get those both with aging. However, one is like you're losing either fat or getting repositioning of the fat. The other one's like kind of like fat herniation. It's kind of, like projecting out through the muscle and it's kind of protruding. And there's different ways that we treat that, which we'll get into a little bit later.
I think there's also a difference too with under eye circles. Is it hollowing and the light reflection is creating a shadow, or is it like hyperpigmentation or some sort of discoloration that's causing the dark circles? Because they're treated very differently.
Exactly. And that's why it's so important to be assessed and have an examination, because it may not be related to volume loss. It may be due to venous congestion or to hyperpigmentation from sun exposure. So, and sometimes it's ethnic variation. I mean, there are a lot of ethnicities where these under eye circles are pretty prominent. In the South Asian population, for instance, we're very prone to having these under eye circles as a common cosmetic concern. I get them myself, and I also treat them. So you also have to kind of take that into perspective as well when you're doing your treatment plans.
Yeah. Why does an under eye hollow form? Like, what are the different anatomical changes that can create an under eye shadow from hollowing?
Yeah. So like we had mentioned, volume loss or dissension of that SOOF, that subauricularis oculi fat pad, that can kind of be positioned and kind of makes your eyelid look more hollow. You can also see changes with, swelling, with allergies. You can see venous congestion. So that can kind of give that appearance of that sunken in look.
Some people can notice like ligament changes. So your tear trough ligament, which kind of pulls right here around your eye, can become more prominent over time and make that ridge look a little bit more advanced.
Yeah, I think there's so many things that kind of go into the dark circles versus the true hollowing. And I think sometimes patients can even have both. And sometimes one will kind of accentuate the other. And so I think, again, going back to just making sure you're seeing a professional who knows how to, treat both and differentiate between both, so you can get the best outcome.
Absolutely. So moving on. So how do we treat these under eye circles or hollows? So it goes back to what's causing it, right? So if we understand what's causing the under eye hollowing or the dark circles, we can really, form a good plan that will be effective. So let's kind of go through some of the treatment options that we have available.
First, making sure you're ruling out things like any underlying like eczema. I see eczema patients all the time who get that hyperpigmentation underneath the eyes. Once you've kind of ruled that out, there are some topicals that will utilize retinoids used in definitely more weaker doses than what you might normally use for the rest of the face. For example, in an eye cream, I think typically is a little bit less strong than your just traditional generic tretinoin that you're getting from the pharmacy. Vitamin C is another great ingredient that can help to brighten, and caffeine you'll probably see in a lot of different eye creams, but the caffeine can help reduce some of that puffiness.
Yeah, I really also like peptides. I think that they do a great job with this delicate thin tissue to kind of really help kind of increase that collagen synthesis. I really love Lumiere. That's what I use from Neocutis. There are a variety of them on the market, but I do think that they pair nicely with the vitamin C's, the retinols, and kind of giving you that extra, collagen boost to help improve the appearance of your under eye circles by, improving the integrity of the skin there.
I think it's important to note, I always disclose when I'm recommending an eye cream that this is not going to be a magic eraser for your under eyes. I think there's only so much that an eye cream can do. And if you're looking for some mild to maybe moderate improvement, you'll get there, but it's not going to be your fix all.
Yeah. And they're not going to help restore volume, but they can improve the skin quality. And I think also, lastly, topically, one of the most important things that we can do is protect ourselves from the sun, because the more UV damage we have to the skin, especially around the delicate under eye, the more skin thinning we can get, the more pigment that can show up. So it might accentuate the hollowing a little bit with that skin thinning, but even the pigment is, I think, a separate entity of under eye aging.
Yeah, absolutely. And that's an area that I will admit that I'm not very good at applying sunscreen. I just kind of like put it on really quickly.
I was just about to say that. You like said a few episodes back about how you just because you get it in your mouth. I remember. So I was like,
I don't eat sunscreen.
So this is a man that wanted to invent edible sunscreen. So I think, but that is so true. Where I think sometimes we just rub it on, but we're not really getting right at that lash line. And I know Dr. Hussein and Heather, I'm sure, have seen numerous cancers that actually can form on that eye line, which is my biggest fear.
I do most surgery on eyelid skin. I see a ton of basal cells, and those are very intricate surgeries, and it's someplace where you really don't want to be operated on if you can avoid it. But there are a lot of great sunscreen products that are especially formulated for the eye. I love the one that we have in our office. I've been using that, and actually that really makes me very conscious of where I'm placing it. I'm making sure that I'm covering it. It's got a universal tint, makes it look good. And I've been really impressed. Courtney actually made a good choice with that pick.
Yeah, one of many.
Because the under eye circles are a problem for me cosmetically. So hopefully that'll help slow down the aging process. I remember the first time I was like putting on it kind of looks like, I don't really use makeup, so I don't really know what it's supposed to look like. So Amna was watching me putting it on. He's like, "Are you wearing makeup?" I'm like, No, this is my new sunscreen. It's a corrector. It's got other ingredients in it too to help. So she's like, "Yeah, whatever."
Yeah, I love that one. Separate of all of that, I did want to mention, because one of my little like tricks that I'll sometimes tell patients, and this goes back more to like puffiness, but sometimes I'll tell patients just to take like a Zyrtec or an Allegra daily and see if that helps, because you'd be surprised sometimes, even people who say, "Oh, I don't have allergies."
Yeah.
We live in North Carolina. I think everyone has allergies, but sometimes you'd be surprised at that puffiness not being correlated with. It creates a shadowing effect where you might think, "Oh, I have dark circles or I have hollowing or whatnot," but it's actually some of that like edema. And when they take that antihistamine daily, they notice such a difference. So it's such an easy thing to try to see if that helps. And then,
That is actually a tip one of my attendings used to give. She was a celebrity dermatologist in Washington, D.C. She would tell everyone to take Zyrtec. And it does make a difference, especially if you have subclinical allergies. Sometimes you don't really even know, you don't have those symptoms, and it just really helps you look better.
Yeah.
And I know, like, for me, like, my allergies were not an issue until it came down here. Like, North Carolina is no joke. Like, I was just like, okay, whatever. And like, boom.
Yeah.
And then the springtime, like when this, like everything's covered in like this layer of like green, like I have never seen anything that's like my life. It's like, it's crazy.
Yeah.
Your under eye or around the eye has a hard time draining lymphatic fluid by itself. And so anything in histamines like Zyrtec can help speed up that process. And we see that even to like post procedures. Any sort of swelling around the eye is going to like pool and pocket at the bottom of the eye.
I do also like cool compresses. I think that, that causes a little bit of vasoconstriction. It feels nice. It helps with, the drainage. So that's something that can be relaxing, easy to do, low cost.
Yeah.
And, that can improve some of that edema that we see sometimes.
I do have one of those eye masks in my freezer, and sometimes just in the morning, if it's really hard for me to wake up, I'll just throw that on. I think like even the coldness helps depuff, but it also just helps wake me up.
I've put a spoon in the freezer, and then in the morning I'll take it out of the freezer and just kind of like place it here. And I guess it's kind of the same thing as cool compress.
So like we mentioned, skincare can only do so much. I think that we are limited in what we can achieve with skincare alone. So let's move on to some technologies that we can use to help improve our skin under the eyes. So what's your favorite device or technology?
I like radio frequency, but you have to be very careful with radio frequency around the eyes.
Do you typically recommend it with microneedling or just on this, like radio frequency?
I do like it with microneedling, but you don't want to go too deep because like Dr. Zane mentioned, that area, even though there's several layers, they're all so tiny and they only make up so much volume and depth. So you definitely don't want to go too deep.
You definitely want to tune it down.
Yeah.
Yeah. And even just traditional radio frequency can do a nice job with tightening and, leading to more collagen synthesis.
And ultrasound.
I've been loving traditional microneedling with a PRP or PRF. That's been, I think, such a game changer for a lot of patients who get a little nervous. I think it's a good segue treatment without being too scary. It's so tolerable.
Yeah.
I think people are worried that it's so close to the eye that it will be painful or that it'll go too deep or these things. And when you're seeing a professional, I mean, I get right up to the lash line on my patients. It's very doable and it helps a lot.
Yeah, and it's like virtually painless and you get great results with it. And, you know, for most patients, you know, if you can, you know, just improve the under eye area with the microneedling, you can also like improve the rest of their skin on their face. And it just really gives you that beautiful glow and you get nice rejuvenation. I'm also a big fan of non-ablative fractional lasers. I love using this similarly to like microneedling. It's creating little microchannels using thermal heat and light, but it's also causing tightening and contraction. And I really like that. We recently did some non-ablative fractional resurfacing.
You guys might have saw my eyes during our Galentine's episode where I told you to love yourself, and here I was.
You never mentioned it, I don't think.
I know. I tried to slyly put it in there, but I'm sure like if people are watching, they're like,
did you look like a train wreck?
She was gonna wear sunglasses, but then you put tinted sunscreen on or something, and it covered it pretty nicely.
Okay. I was still puffy.
Yeah.
I applaud you for going on camera.
And I just want to say, Heather had a patient today that even had numbing and it was on the chin, and she said it hurt. And I had no numbing. So I want to applaud myself for sticking through it.
Yeah, I mean, especially around the eyes. I had another patient who had no numbing, and we were just treating a scar, and she took it like a champ.
Okay.
Like, it's nothing.
I'd recommend numbing.
But I think that extra heat causes tissue contraction. I love that for the eyes. And then if you really want to kind of go for the gold, I think CO2 fractional laser is phenomenal. Like nothing gets a response like that that's outside of surgery. And we see some beautiful results with that.
If you're willing to have the metal shield in your eye too, you know, we could get all the way up to the lash line, which is nice.
Yeah. If you don't mind the medieval look of metal in your eye.
It's not bad when it sits in.
Once it's in.
Yeah.
That's what she said.
So what about chemical peels? What are your thoughts on those?
I think peels can help more so, I find, with discoloration than with a true hollowing. That being said, you do, again, just want to make sure the person that is treating you knows what they're doing. Typically, when I'm doing a chemical peel on a patient, I would say always treat underneath the eye. I'll normally do a light layer last. You want to be especially careful because you obviously do not want to get any acid in the eye. So making sure you kind of squeeze out the gauze and you get that light layer. But I do think it helps more, again, with the discoloration rather than
fine lines.
And fine lines.
Tiny texture.
Yeah, we did the Rev peel on Heather's mom a couple months ago now.
How'd she do?
Good.
Yeah.
She likes the results.
Yeah.
It helped a lot with those fine lines. And that's a more intense peel. So you can do upwards of a TCA 30 or, you know, around the eyes. But again, you just want to be really careful and make sure you're really subtly treating that area.
Yeah, honestly, I try to stay like at 10%. I don't really like going up higher just for those theoretical risks. And you can get some nice improvements even with serial treatments. So I try to be safe around the eyes.
Yeah.
All right, so let's go on to some more aggressive treatments or a little bit more invasive. So, you know, in terms of the hollows, we're looking to restore volume, right? So we need to replace volume with volume. So what are we going to use? So we have a few tools at our disposal. So fillers, like specifically hyaluronic acid fillers, have been a mainstay of treatment for a long time. And we get some really great results with it if you inject properly.
Yeah.
So the problem with HA filler is if you inject in the wrong plane, the results can look awful. And you definitely have seen people, I'm sure, who have had bad work, and you can spot it from a mile away. They look puffy. They kind of have this bluish tinge to their skin. They look, I think, a little deformed. It does not look normal. And you really have to respect the anatomy. Like we said, we focused on the anatomy because it's so delicate. You want to make sure that, you know, you are treating the anatomy with respect. Now, first and foremost, when I'm injecting hyaluronic acid filler, I'm first addressing the volume loss in the mid cheek. That is really where you want to kind of create that support, that foundation, because that, medial fat pad is kind of where we see that atrophy, that shrinking, and that hollowing effect really take place. So if we volumize that, you create a nice support for the tear troughs. And just by that alone, by restoring the volume there, you can improve the tear troughs by sometimes 50, 75% just with volumizing that area. Once you volumize that area, then you can kind of really go to that, natural transition between the eyelid skin and the cheek skin and kind of create that natural transition, very delicate, and you're injecting on bone. So a lot of people think that you're just injecting in the skin, in the dermal space like you do in other areas, but no, you are literally injecting on bone. I feel for bone, and that is the proper plane to inject in. And when I'm injecting, I'm also using a cannula. So this is a blunt tip needle that, we introduce through a small insertion site with an introducer needle. And we're basically using that as a way to inject the filler without harming any of that tissue. So it's not sharp. So it just moves blood vessels and nerves and other tissue out of the way, and we're able to inject. So it minimizes your risk of bruising because there's so much vasculature around the eyes that when you bruise, and it's a pretty bad bruise, and it takes a while for that to dissipate. So that's been a game changer when I transitioned from needle to cannula, especially for the tear trough area.
I think across the board, if filler, especially hyaluronic acid filler, is placed incorrectly anywhere on the face, it can look odd. But because there's so many subtle changes that can be noticeable under the eye, if filler is placed incorrectly, everybody will know. They might not know exactly what happened, but it definitely looks odd.
Yeah, and sometimes when you have too much there, also there's a lot of swelling involved with hyaluronic acid fillers. So you just want to be mindful of that. And if you have too much, especially if you have allergies, simultaneously, it can look really puffy.
Yeah, you definitely don't want to go to somebody who's a beginner injector and trying to do the under eyes.
It's a very complicated area.
Yeah.
And takes a lot of training and skill to do it right.
Yeah.
I think the one benefit of filler truly is the speed in which, instant gratification. Yeah. Whereas some of these other procedures obviously do take time. It is your own natural collagen, but the filler, if you're looking for something that is a lot quicker, if you have an event coming up or whatnot, you might want to consider.
Absolutely. And it can be game changing. I mean, I had a patient this week. He's this 39-year-old guy, always self-conscious about his under eye circles. He's had them since he was young. And he just always looked tired. And, we did some hyaluronic acid, injections under the eyes. And literally after he saw the mirror, he started crying because for the first time, he felt like he looked like himself. He didn't look tired. And it was a response that I wasn't expecting. I thought when he started crying, I was like, oh my God, he doesn't like it. Then he thanked me. I'm like, okay. But yeah, it can be a pretty big game changer. And I've had filler done under my eyes and the tear troughs and, have had good results with it. I do like kind of mixing around some of the technologies as well. And I've been recently doing PRF, which we'll get into. And, all of these have their pros and cons, but filler is a really good option for the right patient. Not every patient's a good patient for it, but, if you are looking for that instant gratification, if you're looking for longer lasting results too, I mean, filler, you can get year to 2 years of really nice results with it.
I think I see a lot, or maybe a decent amount of people who want under eye filler, but they have that protrusion and they think that the under eye filler is going to resolve that, but really they need either, fat replacement or a blef.
Yeah. And fat repositioning. I mean, that's a no-fly zone. If you're seeing those bags on your eyes, if you see those festoons, anything like that, I mean, you want to stay away from filler because it's just going to look worse with more swelling.
It's going to accentuate it.
Yeah.
So let's get into some of the biostimulatory, which I'm excited to talk about because I had Sculptra about a month or two ago now. And one of my concerns, definitely, as probably most people have, is their under eyes. And we treated mostly my cheeks. But I still saw nice results even with that. I mean, I don't know if it's because of the massaging and that Sculptra kind of getting to those areas, but I saw a really nice result pretty shortly after the Sculptra with my under eyes.
Yeah. And I'm liking it. I mean, I read a paper that, we are seeing improvement under the eyes with these biostimulatory fillers. And I do think that it gives a more natural look and it's easier to place properly than filler. So, I mean, if you're going to go to someone who is less experienced or has not done a lot of injections, I mean, Sculptra, if you're injecting the right plane, that's a pretty straightforward injection.
Yeah. PRF is what we had talked about earlier. I think I'm the only one at this table that's not had PRF, so maybe that should get on the book. No, so maybe that should be on the book soon, so I can
do it with numbing.
Do it with numbing. Do it with Pronox. But we're basically using your plasma, as we've talked about in previous episodes, and injecting it into that area, almost like a filler. So we use a gel-like consistency. We're actually taking your plasma and heating it up, essentially, so it becomes this gel, almost filler type method. So we're going in, filling that area, and I think people are getting nice results, nice natural results, where you don't have to worry about filler, the placement, I would say, as much. Your body is able to absorb and kind of use those growth factors to stimulate its own collagen, and you don't have that same risk of placement.
And it does have a slight, volumizing effect temporarily. So I do think that you do see some of the results of that, but I think it's really the long game that you're looking at. And typically we repeat these treatments more than once, and we're trying to really build some of that tissue, that collagen, and just kind of get that improvement. And I see some nice improvement also in the, just the brightness in that area. So I've been pretty impressed with it, but it is a little bit of a slower process than we do see with other, treatments like filler. All right, so let's go on to some surgical options. Obviously, this area is a very delicate area, and anything that like we talked about, those protuberant fat pads under the eyes. I mean, that is a surgical case, and I would definitely seek the treatment with an oculoplastic surgeon to do a lower eyelid blepharoplasty. They are able to go in there, really reposition that herniated fat and make it look much more cohesive and smooth, and it can be a game changer. And the oculoplastic surgeons are ophthalmologists who have an additional fellowship training in plastic surgery around the eye, and they know the anatomy inside and out, and that's who I would refer my patients to get an excellent job. And I had some training in residency, but it is very intricate, and there's some structures that I just don't have the tools and the right equipment, and if God forbid we have a complication, I don't feel comfortable like being able to fix it. So that's why I kind of refer those out, just to give the patient the best possible care.
Yeah, and you have to be careful with fat transfers too, because we were talking about this earlier, that if it's placed too superficially, it's going to be easily noticeable. I had a colleague I was working with who had a fat transfer, and one of her under eyes was placed too superficially, and you could easily tell. And it's very unfortunate because, you spend so much money and hopefully you're going to somebody who's very experienced with it, but it's right on the front of your face too. Yeah. So,
I mean, it is a technique that's been used for a long time, and you can get beautiful results. The problem I have with fat transfer is you're basically using a biologically active tissue, right? And it all has metabolism and placement, and you don't know how much it's going to take. It can be asymmetric. I've seen, patients where like they had asymmetric volume loss of the fat pad, so it just didn't look even, and you couldn't do anything about it. I had another patient who went overseas for a fat transfer, and she developed this granulomatous reaction to all the fat. So her face was like literally like turning puffy everywhere. And you can see like little nodules forming wherever she had like fat placed.
Oh my gosh.
And, like things can happen like that. And, you just have to be very careful.
Yeah.
Yeah. So we talked about a lot of the treatment options for the lower eyelid and the under eye hollows. I just want to spend a little bit of time on the upper eyelid. I know that wasn't the biggest focus of this podcast, but I think it's worth a mention because we see a lot of patients who are concerned about, hooding of their upper eyelids, looking droopy, can't really see properly. Oh, please.
Also, we're so in sync because I was also just about to bring that up.
Yeah. Great minds think alike, right?
Yeah.
So, with aging, sun damage, and, your skin just loses laxity as collagen and elastin, tend to degrade, and you get hooding. And you have probably seen patients, especially elderly patients, where there's excess eyelid skin, and sometimes it can impair vision. And, it's a relatively easy treatment where you cut the excess skin, but you have to be very precise. And you want to measure, make sure that you have the anatomical markings, and really, excise the right amount of tissue, because that's key, because if you take too much, that can be a problem. But you can get some beautiful results. I had a blepharoplasty patient today who came back for follow-up. I think we did it like 2 or 3 months ago. Looks beautiful. She's very happy with the results, but you just have to be very careful about, how to do that surgery. And if they have ptosis, there's other, techniques that you have to use to help address that. So it can be subtle. For straightforward cases, I think, a good cosmetic surgeon, a dermatologist, an oculoplastic surgeon. But if it's something more complex, I send those to oculoplastics as well.
Yeah, my dad had a blepharoplasty, upper blepharoplasty. His was covered by insurance. It was impairing his vision, and it went really smoothly. He said he would do it again in a heartbeat. He looked like a Hannibal Lecter for a week because you have your stitches in there, and they're teeny tiny stitches, and there's usually about, 8 to 10. So, and you bruise, obviously. But once that whole course is finished, the results are remarkable, I think. So
it can make a big difference. You can look decades younger just by addressing that eyelid skin.
What do you think about Botox? I feel like we get a lot of patients that ask, oh, well, can I do a little brow lift? Will that help with the hooding if I put some tox?
It can only do so much.
Yeah.
And if you have, really a lot of dermatochalasis, I don't think that you will get that result that you need, especially if it's impairing your vision. That's surgical, in my opinion. But you can get a nice, brow lift, a chemical brow lift. You can also treat the crow's feet, the orbicularis oculi muscle under the jelly rolls to just kind of help improve, the appearance. But you have to be, careful. You have to make sure that they have enough skin integrity. I do the snap test to make sure that, they have enough tension and it's not going to lead to something called ectropion, and it just kind of droops. Yeah. All right. So that's our upper eyelid discussion. And in summary, we have looked at the various causes of under eye issues, such as hollowing, hyperpigmentation, also protrusion. And I think it goes to show you that you really have to assess your patient carefully to really address and understand what's causing the issue that they're coming in for and properly treating it. And patients should have a customized approach. Not every patient is coming in for the same problem. And I know that there are places that use the same methods for every patient, and that's not doing a service to your patient. We really need to find out what's going on and properly address it. So, the under eye area is a very common area of insecurity for patients. I've dealt with it. I think many of us have dealt with it. And there are things that you can do. You don't have to suffer in silence. You can seek the guidance, of your board certified dermatologist, your oculoplastic surgeon, plastic surgeon. And there are things that you can do to really help improve and restore your confidence. So I definitely encourage you to seek out expertise if you need it. But, I think that we can do a lot, non-invasively these days. And that's a really nice thing to be able to offer, especially patients who are worried about surgery.
Yeah.
I was going to say there's a lot of different options for different comfort levels. So I think that is incredibly helpful.
Yeah.
All right. Well, I think this was an enlightening discussion on a very common issue that we deal with, the under eye hollows. And hopefully this gave you some insight on some of the treatment options you have available. So until next time, Skinside
Out.
Thanks for listening. This episode of Skin Side Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.